Fit, active, healthy, happy, enjoying the prime of your life. Looking out for your health and wellness, this is Health Talk with Fred Lowry from Lowry Drug in Statesville. Visit Fred at his store, conveniently located on Hartness Road in Statesville.
Good afternoon. This is Fred Lowry, pharmacist and doctor of natural medicine at Lowry Drug in Statesville, North Carolina. And this is Health Talk, pre-recorded for October the 3rd, Friday afternoon. October, I think, one of my favorite months of the year. Coming into the winter, and it gets a little cooler. This program is intended to share knowledge and information based on my research and experience. This is not intended to offer individual advice, nor does it replace a one-on-one relationship with a qualified healthcare professional. Your daily choices are yours and have more to do with your health than anyone in the healthcare field. My hopes are that this show will empower you with knowledge to take a more proactive approach to your health. Some of my sources include, but are not limited to, various health feeds, Epic Times, Mercola, Children's Health Defense, PubMed, and some Substack hosts. We are exploring a lot of the facets of your health and keeping you up to date and informed. I've got a good show for you today, I think. We're going to take a deep dive into the Tylenol thing that has surfaced quite a bit in the news in terms of chronic illness and autism. And later we're going to tell you about one of the things that people consume quite often that could be labeled as poison. So, last week we talked a little bit about the concept of the Tylenol situation, and that, it came out that it's associated or may cause autism. I did have some reservations about that in terms of that being the actual cause. There is a mechanism for how that can happen. But the first thing, of course, is the toxic load of the vaccines kind of sets up that situation. I'm going to explain more about that as we move forward here. So basically, one of the things that we'll be exploring is how suppressing acute symptoms, but symptoms that may be manageable, may be transforming things into more significant illness. A lot of this information comes from the Substack of a Midwestern doctor, which is a good thing to look into. A lot of great information there. Of course, last week, I think there was some announcement related to President Trump and the thing about the Tylenol or acetaminophen. Kennedy also spoke and said that 40% of the mothers who have children with autism believe that their child was injured by a vaccine. I can say that all the mothers that I've talked to would say that. So one of the things that we run into is how you manage pain. And so one of the more common things that people have taken for years and considered pretty safe, and I would count myself in that category in the earlier days of my pharmacy career. But it kind of looks at how we treat pain, and most people find that pain's uncomfortable. Obviously, we are creatures of comfort, and we gravitate towards that, and that includes, if you're cold, you put on a coat or you change the thermostat. If you are emotionally uncomfortable, you might distract yourself or use other methods of dealing with that. But we basically have pain relief medications, acetaminophen, anti-inflammatories, non-steroidals like ibuprofen, naproxen, those type of things. And we also use steroids, but all these things have side effects. And so pretty much the first line of treatment for pain has been acetaminophen. including ibuprofen and naproxen, but all of these medications have some toxicity, and it's dose dependent about that toxicity. So people with a lot of pain that's unresolved, they continue to take these pain medications, and some of these are effective for some people and some just moderately effective. And so when they're moderately effective, the thing people do is take more. And so this can be dangerous. The toxic load of acetaminophen is considered 4 grams, 4,000 milligrams, but I think it's probably a lot lower than that. A toxicity does happen at lower doses, and so we've got that. We've got the NSAIDs, considered to be one of the more hazardous drugs. Those are the leading cause of drug-related hospitalizations due to heart attacks, strokes, bleeding, and kidney failure. There's a 20% increased risk of kidney disease with NSAIDs. Cardiovascular risk increase minimally 24%. You probably don't remember the drug Vioxx that had some serious cardiac issues and was withdrawn from the market. So Tylenol or acetaminophen, Tylenol is the trade name, is an alternative to the NSAIDs. May be helpful for moderate pain, not so much for severe pain. There is an association with stomach bleeding, heart attacks, and strokes with that medication. Intestinal bleeding is actually common. NSAIDs fall in that category. Medications, some of these impair healing. We'll talk more about that, but especially ligaments. And so one of the things that comes to mind with that is if you're on anti-inflammatory, and also if you take an antibiotic like ciprofloxacin, in drugs in that category, those have an association already with an Achilles tendon rupture. And so if you're taking ibuprofen or other NSAIDs along with that, might increase your risk for that. So in some cases, we're creating the illusion of benefits where maybe none existed, and some people have really impacted their life for drugs that really didn't help them that much. So NSAIDs are still one of the more commonly prescribed medications. This doctor has done a lot of work bringing attention to DMSO as an alternative to some of these things. We don't have time to discuss that, but something to look into. So Tylenol influences the liver heavily in the detoxification pathways, and it limits glutathione, one of the antioxidants of the liver. Coming up on a break, more on this. I'm going to explain the vaccine issue. Welcome back to Health Talk. So we're talking about Tylenol and the association with autism and other neurological type illnesses or effects. And I want to tell you that, of course, the concern is, particularly for mothers, is what are you going to do for a child that has a fever? It's typically been, the Tylenol is the thing to go to, basically, or has been in the past, very common. And I will tell you, I'm going to give you some great options for that as we work through this. So stay tuned for that. So So when you look at the use of Tylenol, and I mentioned how it impacts the liver and the glutathione. So the Tylenol is basically, or acetaminophen is toxic to the liver. And where do you process toxins? And that is the liver. So the connection with autism is, the components of the vaccine that are toxic to the individual processed in the liver, and so the child gets a fever, a reaction to that particular vaccine or whatever that intervention was. You give Tylenol, now you're impairing the body's ability to get rid of whatever the toxin is or the things that caused. Now, the original report, just as a sidelight, was really associated to women that were pregnant and taking acetaminophen. Certainly, during pregnancy, there's some crucial developmental points or times in the fetus, and so that could certainly be an issue. And by the way, it may be that just I don't understand this whole thing in terms of all the complexities of fetal development. There's a lot of information out there, but this is so complex that I really doubt that science is ever going to really truly get a full handle on the complete complexity of all this. So, when you're talking about having fevers, and then Tylenol is put in, and you're inhibiting the body's ability to get rid of some toxin. Now you're more prone to particularly to neurodevelopmental type disorders. So disorders in the development of the neurological system of the fetus. So, why do we treat fevers? The fever is a mechanism for the way the body deals with infections and inflammation, could be viral or bacterial. And we've just gotten to the point that if you have a fever, let's treat it. And some of that concept is, well, we have to do something. And so maybe you treat the fever, individual feels better for a little while. But in some cases, doing nothing is better than doing something. And that may be the case here. So, in a hospital setting, say an ICU, we want to treat fevers that wanted to be treated because fever causes stress on vital organs, requires more energy for the body, etc. So when you treat the fever in that situation, you may improve the survival rate, but at the same time, they acknowledge that these fevers are very healing. So, to reduce the discomfort of the fever, Tylenol is given, and that was certainly is in the past, and is now a very popular medication. So there are arguments against treating fever. Pardon me. So some fevers can provide diagnostic kind of information. So sometimes if you suppress a fever, then you're not really understanding what's happening. And so infants, children can seemingly spike fevers, around 100 or, just for a brief time. I've seen that happen and they go away. There are situations where these newborns that get hepatitis B vaccine get a fever from that, and of course it's a mistake to treat that with Tylenol. Some autoimmune and infectious diseases can be part of that situation. one of the big concerns is if you have high fevers, you could have brain damage, and so that's always something I think that comes to mind. So elevated fevers, extremely elevated, can be considered a medical emergency, and the treatment threshold for that is 105.8 to 106.7. According to Penn State, the brain damage from a fever generally does not occur unless the fever is over 107.6. Nobody's really going to be comfortable with that. I'm certainly not. But a fever of 103, that's a perfect fever, basically. And so for me, this decision is entirely up to you. If the fever gets up to 104, that may be something you'd want to treat. Now, one of this takes a little bit of doing, but one of the best ways, other than homeopathics, to lower a fever is you can do cool baths. You can get the water temperature of a bath about the same temperature as the child, and put the child in the bath and let the water gradually cool off, and that'll bring down the fever. It's probably not a good idea to do cold because that can be a shock for the body. So, the problem with vaccinations is that when people get sick or fever, what do? You go for the Tylenol. It's a problem. Tylenol is not only toxic to the liver, but it's toxic to the whole body, and that is dose related. So it's believed that the likelihood of issues related to autism and is associated with those vaccines and the inability to detoxify properly. This article covered the infamous 1918 flu pandemic. It was certainly a deadly pandemic. The interesting thing about that is one of the things that has been associated with the high rate of death historically goes back to the use of aspirin, and aspirin actually came off patent just before that pandemic, and they were using a lot of aspirin to treat this. Now, was that the sole culprit of all the deaths? Don't know, but suppressing that fever with the aspirin and all the other toxicity of aspirin, they were using aspirin in much higher doses than we use it now. So that could have been an issue. The function of fever basically helps boost immune cells. It inhibits viral replication. It triggers something called heat shock proteins that activate immune defenses. It slows down pathogen growth to help perhaps control infections while the immune system kicks in. One of the things that has come up in the vaccine world is the use of smallpox vaccines, and many do not know that the anti-vax movement actually originated with that as a result of vaccines' failure to protect against smallpox and also injuring children. So this was, the skin prick thing, and they were looking for that reaction on the skin, and some that did not react, they would say the vaccine didn't take, so they said they would do it again. So, and this was a problem when they double dosed that. There were distant physicians of the area that had the perspective that the skin reaction was a proxy for a functioning immune system, and those vulnerable to smallpox in the first place were those who the vaccine, quote unquote, would not take. They also had a lot of highly unusual neurological disorders following smallpox vaccination. So this is not historically a new thing. One of the things that I learned in the world of homeopathy was how suppression of symptoms actually can push a disease deeper into the system and creates these chronic illnesses. We're going to talk some more about that and some of the lessons from Chinese medicine when we come back. And also I'm going to give you some great homeopathic remedies to treat fever, particularly in children. Stay tuned for more Health Talk.
Doctor, my eyes have seen the years.
Welcome back to Health Talk. Lowry Drug on Hartness Road in Statesville was established in 1959. We're a traditional family pharmacy with a state-of-the-art compounding laboratory. We offer a full line of medical equipment and supplies, including CPAP, scooters, lift chairs, and oxygen. We also have a full line of supplements, nutritionals, herbs, essential oils, homeopathics, and more. Come see us. I'm going to jump just a little bit here from what I was talking about, so I'll make sure we have enough time to cover this. And that is the homeopathic remedies for fever. So, and I want to give you, before we do that, I want to give you one more little naturopathic trick. You know, over the years, water has been used in many ways to treat people that are sick. Not just internally, but externally. One of my old mentors told me about the wet sock treatment. Sounds unpleasant, and it's not necessarily a lot of fun, but it does seem to be effective. So if you feel like you're getting sick, you can take a pair of cotton socks in the evening and wet them, put them on your feet, and then put a pair of wool socks over the top of that and go to bed. And typically what happens is that your feet will get cold initially, but then you'll start getting hot, and your feet get hot. It actually can stimulate a fever. And so if you stay with that fever, a lot of times you'll wake up in the morning and be perfectly okay. A lot of times you'll find that fever starts and then breaks at 3 o'clock. So the idea is to stay with the fever if you have the temptation to get cooled off, so the cover's off. If you've got the grit to do it, just stay under the covers and sweat that out. There are other people that actually use infrared saunas to increase body temperature when they feel like they're getting sick. That was another method. So homeopathic remedies. There are a number of homeopathic remedies out there that are good for fever. There's probably at least 10 that are very common. And so each one of these remedies has specific situations that relate or associated to that remedy. There are some products out there that have combinations of these remedies, which makes it a little easier. But these remedies and the remedy picture for them become really useful in treating fever, particularly in children. And you can see almost miraculous results from that. I remember one of my grandson had a fever, and his face became bright red, and he was uncomfortable, and I selected the remedy belladonna for that, and these are little pellets in a 30C potency, and it was miraculous. Within about 30 minutes, he was better, and it was like it never happened. And I've seen this many times. So belladonna, as an example, is a fever of an inflammatory origin. There could be pain in the throat. Usually red is associated with that, red face. The head becomes hot, but the feet are cold. There can be some burning heat, a throbbing headache, and being sensitive to light. So, some of you may be taking notes about this, but you can go online and look for these remedies, and it'll give you the symptom picture. So what you're trying to do is match up a remedy with a particular symptom picture. Ferrum phos, which is iron phosphate, has a picture of a pale face but rosy cheeks. It's really good in the early stages of fever, generally low-grade fevers. There can be some weakness and fatigue associated with that. I know this kind of sounds a little bit complicated, but once you start to familiarize yourself with some of these remedies, it's not quite as bad. So another remedy is aconite, and aconite is a really great premier anxiety remedy for people that have fears and anxiety. It's a good remedy for inflammation in the early stages, particularly fever that's associated with being restless or having anxiety. Usually these individuals want more water, have a lot of body aches, chills, and they want to be covered up. So in contrast, some people don't want to be covered up. Some people want to cool off. So being able to discern the different situations and the symptom pictures can be helpful. Bryonia is a remedy for fever with body aches. And so people want to lie down and be still. They don't want to move. More thirst. They get worse from warmth and movement and touch. And they might even want to lay down on whatever their painful side is. So I hope you're kind of getting a picture of how specific some of these remedies are. Eupatorium is a remedy for people with fever with bone and muscle pain. Some people experience fevers, and in different ways, and it's probably also related to whatever the pathogen is or the cause of that fever. So that's a pretty interesting remedy. Gelsemium is a remedy that's been used to treat flu-like symptoms, and keep that in mind. You generally don't want water. They seem to be worse in the afternoon, suffer from weakness and dizziness, a lot of exhaustion, and they preferred to be covered. So that would be another remedy. Arsenicum is homeopathic arsenic. And keep in mind, these remedies are so diluted that there's not a single molecule of that original substance. That happens at about 12C potency. So people have concerns about that, and they also would say, well, I don't understand how that would work, and I get that. But this is not about substance. It's about frequency, the energy that was left in that remedy at that particular potency. Arsenicum is a premier food poisoning remedy, and for people, it's something everyone should have in their travel kit just in case, but it has been used for infections related to bacterial things of the gut, also associated with burning pains and restlessness and cold and clammy sweat, sometimes associated with diarrhea. Stay tuned. We've got more coming up on Health Talk, and I hope you may be getting an appreciation for this. I'm going to delve into this a little more when we come back, particularly in terms of suppressing symptoms, and which creates more and more illness. Stay tuned for Health Talk.
'Cause I have wandered through this world, and as each moment has unfurled, I've been waiting to.
Welcome back to Health Talk. This is Fred Lowry, pharmacist and doctor of natural medicine. We're talking a little bit about concepts, really, in health and suppression of symptoms. And so your body has these mechanisms to be able to deal with toxins that come on board. And really what happens is every time you suppress those symptoms, your body has to push whatever that toxin deeper into the system, and that's how chronic illness is created. So on the first level, the body has comes in contact with a toxin, and you have the first stage of excretion. That could be a runny nose, coughing, sweating, vomiting, diarrhea, getting rid of whatever it is. If you suppress that, then it pushes it deeper into the system, and now you've got inflammation. And inflammation is another way that the body deals with things that are in the body it wants to get rid of. It's part of that process. And so when we use anti-inflammatories or things that cover up the pain, it pushes it deeper into the system. And then those toxins have to be deposited in connective tissue, the third stage, and that's deposition. And that's where you start to get the breakdown of tissue or connective tissue, either in the joints or issues in connective tissue of the skin. So Chinese medicine, I will tell you, is something I don't really have a great handle on, but there are some concepts in there that are somewhat helpful. They had a long history of treating people. It was quite an interesting thing. But some of the issues related to smallpox vaccine is mirrored in the concept in Chinese medicine of blood stasis. And so in Chinese medicine, there's a belief that the symptoms of a disease vary depending on how deeply they have penetrated the body, and different treatments are used to treat depending on the stage of the illness. So that mirrors what I was just talking about, because, if you have excretion first, you suppress that, it gets into a deeper part of the body, and you have inflammation, and you suppress that with anti-inflammatories, and and then it goes deeper and deeper. And by the way, there's 3 other stages to this, all resulting in cancer. Part of that's outside the cell, and then when it gets into the cell, that's where bad things really start to happen. But in Chinese medicine, what is the toxin and how deep has it penetrated? And so when you get into the issues of this microclotting that happens in the capillary beds, there's a decreased electrical potential, and then things get worse. So natural healers have the concept of healing requires movement of things that are deeper in tissue to the surface. And most of the people that have this concept deal or homeopaths really, and part of that goes back to the things I just talked about. This was mapped out many years ago and explained quite well in the 1940s with Dr. Rekovic that wrote a book on homotoxicology, and so part of this when you have these symptoms and you start to get well, you reverse what's happened. So the symptoms that you had before that had gone away now come back, and you think, oh, I haven't had that symptom in 15 years maybe. That's a sign that you're actually getting better. So basically in this case, chronic illness comes from the suppression of symptoms. And so when you throw in all the toxicity of all the other things that happen, it's pretty amazing because some of these childhood illnesses, getting them is associated with not having something in the future, like brain cancer, childhood chickenpox infection. It decreases that risk. So there are other things out there. There's that's a whole nother topic. But then when you get into things like suppressive antibiotics, one of the concepts in Chinese medicine is called latent heat. So when you have a pathogen that gets in the body, a bacteria causes symptoms at the time, sometimes they cause immediate symptoms, sometimes not. So things might incubate and turn into inflammation or heat later, which, by the way, we think about a lot of these things that when you get some type of infection, you take an antibiotic and it goes away. That a lot of this bacteria is still there. It's just in a different form. It's changed into something else. And so the same thing, not in terms of change, but same things may be true in terms of viruses. So a lot of the things that we've come in contact, let's just say Epstein-Barr virus mono, that we may have had as a teenager, that's probably still there in a low-grade situation, and your body, your immune system is keeping that in check. So when we take antibiotics in vaccinations, these are now proposed as a source of what Chinese medicine called latent heat. Pardon me. So there's this other concept of cell wall deficient forms of bacteria. A lot of the antibiotics destroy the cell wall, and that's how it kills the bacteria. But now they've recognized that in some cases the contents of the bacteria become part of that, a different form of that bacteria. And so when bacteria are exposed to stressors like a cell wall destroying bacteria, most of them will die, but some will instead enter a primitive survival mode and transform into a misshaped or cell wall deficient type bacteria. Also, one of them is known as mycoplasma. So that change is there. Now you have to deal with that. So in some cases, the use of antibiotics becomes, if you will, when you're trying to kill a bacteria, something you can't actually catch. You're chasing something that you can't catch. Yes, you might feel better. Yes, that bacteria may go away temporarily, but not forever. And so, particularly in illnesses like Lyme's disease with Borrelia, Bartonella, those types of bacteria. A lot of these bacteria can, with a lot heavy pressure from antibiotics, can morph into other things. And now you've got a whole different situation because you've changed the body's terrain. Now, I do want to say that antibiotics certainly have a use in overwhelming bacterial infections, probably in order to give the body's immune system a chance to catch up. There's certainly things with that, but there are other ways to deal with some of this issue. So it becomes a kind of a judgment call in some ways as to what to do. But your body does have the mechanisms to heal, and the more you suppress things, the more problematic they become. One of the best ways to improve your situation is the concept of terrain and improving the body's terrain overall, which means improving hydration, bowel function, elimination, improving your diet, eliminating as many toxins as you can. It's amazing to me that apparently about 60% of the population still drink soft drinks, a metabolic poison, if you will. So improving your diet and all these things, and your body's already started to heal. There are certainly tools that can improve that situation, but having this basic understanding that when the suppression of something, depending on that situation, can result in more and more problems. And so it becomes a choice as to how you want to deal with that, and everything's kind of situational. But I hope this has given you appreciation for the way illness happens, and also appreciation for the fact that there are some really great homeopathic remedies out there that parents can use for children instead of drugs like Tylenol and ibuprofen. Thanks for tuning in for Health Talk. Have a great weekend.